front of the neck pain is not caused by tight muscles. It's caused by the shutdown of your deep neck flexor muscles and the overactivation of the superficial muscles in the neck to pick up the load. This happens as a result of, most oftentimes, as a result of device uses, your lifestyle, and a lot of times people going to the gym to work out and they go beyond what their upper body is capable of doing and they bring the neck muscles into the picture. So if they're lifting something and their arms cannot lift, their neck goes forward because they're trying to bring this muscle or the weight up here to perform the exercise, but they're not paying attention to their proper form and mechanics. Oftentimes, people ask me, well, how many times do I need to do this exercise? How many sets and reps? The reality is, you should not pay attention to the reps and sets if you are ignoring the principles involved with proper movement and mechanics. I've done videos on what those principles are. So hopefully you have subscribed to my channel. If you haven't, please do so and search my website for not website, the YouTube channel to learn more about these things. I'm going to see if my team can retrieve that video and put it at the end of this video. But to move on to what's happening, a lot of times what ends up happening, I'll show you the side view, the neck goes forward because your devices say so, and the back of your neck muscles, whose job is to bring the head back, are overstretched, their hands are tight. You use your front of your neck to shove the neck back, but that wasn't their job to begin with. The role of the front of your neck muscles is to stabilize the neck, not to push the neck back. That's the job of the back of your neck muscles. These are all compensation patterns that are taking place because there's a stability in your movement, instability, not stability, instability in your movements, and you are having compensation and dysfunctional patterns of movement to begin with. So what we want to do is we want to activate the right muscles and we want to take away the things that pull us out of the healthy environment. There are certain exercises that I recommend to my patients. All the exercises that I recommend are developmental exercises. You cannot strengthen, you cannot stretch an area and expect to get a result when proper mechanics are not in place. Proper mechanics bring stability. You cannot build a structure over an unstable ground. So lay the foundation right, repeat, and strength comes with that. I use developmental exercises because these are the same exercises every walking human being on the planet Earth does as a newborn baby to become a running toddler. The body parts coordinate with each other. There's a coordination of movement. There's a stability in your joints. There's balance in the movement. These are all necessary ingredients for the strength to then be the next step. So the two exercises that I'm going to show you are targeting the neck, mid-back, your arm and shoulder blades. All of those areas are involved every time you have a neck-related issue, even though it's not the neck. So it's a system of areas that you need to address. The first one, believe it or not, is what you did when you were about 6 weeks old. So from 6 weeks of age till 3 months, you went on your tummy time. That's when your body parts provided the support for the back of your neck muscles to then build strength. So what you do is you go on your tummy, spread your elbows out. The crease of your elbow is at your ear hole level. You go on your forehead. You're going to be pressing on the inside of your elbows. When you press there, your shoulder blades, watch my shoulder blades, and you see that my shoulder blades gently slide down my back. If I let go, it goes up again. So you're not lifting your arms up, you're not shoving them like so. It's a gentle downward migration of your shoulder blade over your rib cage on the forehead. Scrape your nose, get the tip off, look up another couple inches, hold the head. Now, from between your shoulder blades, start gliding your neck up and you hold it. The whole time you're pressing on the inside of your shoulder, of your elbows, with your shoulder blade going down your back. Then you go down and you repeat. So that's one. The next one is what you did towards the end of the third month in your life. It's an offshoot of what I just showed you. You're going to place your hand under your shoulders. So if I draw a line from the top of my shoulder to the ground, my fingers are just behind it, not so far behind it, and definitely not beyond that point. The top of my shoulders are going away from my ears. Scrape the nose, get the tip off, look up a couple of inches, hold the head. From between the shoulder blades, start lifting the neck up. Make sure you don't drop your head down. And then top of the shoulders away from the ears, and from the elbows to the outside of your wrist, you apply pressure and you lift your chest bone off the floor. Do not squeeze your butt. Do not engage your lower back. Hold this and come back down. These exercises allow the back of your neck muscles to work together, the front of your neck muscles, the deep flexors, engaging your mid back to learn what its position is, your shoulder blades to lay nice and flat over the rib cage, and for your triceps that allows the signaling of the shoulder blade to activate your shoulder blade stabilizers kick in. This is what the beauty of developmental exercises are. That's what this channel is all about. This is what my clinic is all about. If you have not subscribed to the channel, make sure you do. If you need to contact me, use one of the methods of contact in the description box to contact me. Until next time, take care.